Hi, I'm Dr. Larry Malerba, and welcome back to All Things Homeopathy. Today I'm going to talk about the homeopathic treatment of physical trauma. The prevailing wisdom regarding musculoskeletal injuries is to apply ice in the acute phase, heat in later stages, and to take in anti-inflammatory painkillers for symptomatic relief. This is a good example of conventional medicine's one-size-fits-all approach. But this stereotypical response often clashes with reality because, as homeopathy teaches us, all injuries are not the same. The key lesson that we learn over and over again is that all health conditions, including injuries, manifest in a manner that is unique to the individual. For example, some injuries are soothed by heat, while others are aggravated by heat. Some feel better with gentle motion, and others are made worse by motion. While it's true that some injuries do respond to the stereotypical protocol, there are nevertheless a good number that do not. Effective homeopathic treatment of physical trauma requires careful observation in order to determine the remedy that best fits the situation. Remember, there are no one-size-fits-all treatments in homeopathy. While many accidents and injuries can be handled at home with simple first aid homeopathic care, always use common sense and seek professional care when necessary. So let's get started. Okay, so I'm going to talk about some of the main physical trauma remedies from three different perspectives. First, I'll discuss first line of defense remedies. Second will be remedies according to types of injuries. And third will be remedies indicated for more specific injuries and special circumstances. Some of these categories will overlap, but that's okay because it bears repetition for the purposes of learning. By far the most important first line of defense remedy is Arnica montana, which can be useful in almost all types of physical trauma. Arnica should always be thought of first in the earliest stages immediately after an injury occurs. Whether it's a nasty bruise, a strained muscle, or a joint injury, several doses of arnica taken within the first few minutes or hours can do a great deal of good, and certainly no harm. Oftentimes, arnica is all that is needed to facilitate a quick and easy recovery. Arnica is particularly indicated in soft tissue injuries where we expect to see pain, swelling, inflammation, and black and blue discoloration. If administered quickly, arnica can sometimes prevent these symptoms before they even have a chance to develop. By the way, please note that I discuss arnica in greater detail in ATH episode number 6. The other broadly applicable first line of defense remedy is calendula, which is a preparation made from marigolds. Its main use is in the treatment of open wounds, like cuts, burns, and abrasions. It is most often applied topically as a cream, ointment, or lotion. Calendula helps with pain and bleeding and acts as a natural antibiotic to heal wounds. Think of it as the homeopathic version of bacitracin. For more serious wounds, calendula can also be administered in potency. Note that while calendula and arnica can both be applied topically, arnica should not be applied to open wounds. So arnica is our first line of defense in most trauma cases, while calendula is used to help heal broken skin. Now let's talk about the different types of injuries. In the event of bruising, once again, arnica is the main remedy. It's indicated when we see pain, swelling, and black and blue discoloration resulting from bleeding under the skin. Don't overuse arnica for every little bump and minor bruise. It's preferable to reserve oral treatment for when it's truly needed and to use topical arnica for minor injuries. Leadum can be of use in the later stages of bruising. As time passes, the original black and blue color may change to a greenish yellow. The keynote here is that when the pain is clearly ameliorated by cold applications, we think of ledum. For cuts and lacerations, as previously noted, calendula is the main remedy. Staphysagria is indicated when the pain of a surgical incision persists longer or more intensely than it should. The same applies to any clean cut from a knife or blade. Hypericum may also be helpful for the pain of a laceration, especially when it involves a nerve-rich area of the body, like the fingertips. This commonly occurs while slicing produce with a knife. Ledum is the main remedy to use in all types of puncture wounds. This may be from a needle, a knife, or stepping on a nail. Ledum can help prevent the constitutional sequelae or after effects from such wounds. Hypericum is also indicated for puncture wounds, especially when associated with any residual nerve pain. Think of this remedy after lumbar puncture or after the administration of an epidural or spinal anesthesia. In the case of a sprained joint or a strained ligament or tendon, it's always reasonable to initiate first line of defense treatment with arnica. Another more specific remedy can always be given afterwards, once there's been opportunity to observe the patient and his or her symptoms. Bryonia is commonly indicated, especially when the injury is severe enough that any type of motion elicits pain. The person who needs bryonia wants to keep the sprained part still in order to minimize the pain. The keynote here is worse from any motion. Rustox is the remedy of choice when the injury feels worse upon initial motion, but better from continued motion. The sprained ankle, for example, hurts initially when taking the first few steps, but then the residual pain and stiffness improves by gently walking it off. Rustox injuries feel better from warmth and worse from cold or dampness. Rustox is also physically restless. The injury makes it hard to sit still and compels the person to move or to change position frequently. The keynotes here are restlessness and stiffness, both of which are better from warmth and motion. Bryonia and Rustox are well-known complements. Bryonia often fits the initial painful stage of a sprain, while Rustox may fit the later stages once stiffness settles in. Ledum is indicated especially when the sprained part feels cold, and yet, paradoxically, cold applications bring relief. In addition, warmth aggravates the pain and or stiffness. The keynote here is better from cold application. Ruta has many similarities to Rustox. It can be hard to tell the two apart. Both have pain and stiffness and aggravation from cold and damp. But the main difference is that Ruta is aggravated by certain types of movement in certain directions. A tennis elbow, for example, may hurt while serving, but not when hitting a forehand. Rustox is aggravated by initial motion, but then better from continued motion up to a point after which it is worse again from overexertion. Once again, in the event of a bone fracture, the first line of defense treatment calls for arnica. Bryonia is also frequently indicated because in such situations, the person tends not to want to move the injured part. Symphytum is another good remedy for bone pain and bone healing. It is made from comfrey, aka knit bone. It is important not to use this remedy until the fractured bone has been set properly. This may require a repeat X-ray in order to ensure proper alignment. It's a mistake to accelerate the bone knitting process if the fractured parts are not properly aligned. The same applies to the remedy calc phos. It too can help with bone pain and healing, but it should not be taken until the fracture is properly set. The main remedy for nerve injuries is hypericum. We think of hypericum anytime there is an injury to a nerve-rich part of the body. Specifically, this means injuries to the spine, tailbone, eyes, teeth, tongue, and fingertips. Hypericum is useful especially when there are sharp, shooting nerve pains resulting from cuts, bruises, puncture wounds, and other trauma to these areas. There are a few good remedies for bleeding. Again, it is perfectly reasonable to begin treatment with arnica. Arnica can be helpful for internal bleeding, as in the case of bruising under the skin, or for external bleeding. When bleeding is profuse and bright red, we always think of phosphorus first. Ferrum phos is a good second choice when there's bright red blood. Hamamelis is indicated when the hemorrhage is slow and steady, consisting of dark venous blood. It's important to understand that anything worse than a first-degree burn should be taken very seriously and must be examined by a professional. For burns with minimal skin damage, consider the following homeopathic remedies. Urtica urins can be used both orally and topically for mild burns. Cantharis can also be used orally or topically, and causticum can be taken orally for burns. Okay, so now that we've covered types of injuries, let's talk about remedies for more specific circumstances and more specific parts of the body. For ankle injuries, think of arnica, bryonia, rustox, ruta, and ledum, as previously discussed. Ledum is frequently indicated for ankle injuries. For injuries to the ulnar nerve or funny bone, hypericum is the remedy of choice. For the repetitive strain that leads to tennis elbow or golfer's elbow, think of ruta and rustox. I've often wondered how many elbow surgeries for professional baseball pitchers could have been avoided with a few timely doses of the right homeopathic remedies. For wrist injuries, consider arnica, bryonia, rustox, and ruta as previously described. Hypericum is the main remedy for cuts or bruises to nerve-rich fingertips. Staphysagria is another good choice for cuts to the fingertips. Head injuries can have many different symptomatic presentations and should receive a thorough medical evaluation. Nevertheless, a great deal of short-term pain and long-term suffering may be avoided by administering arnica as a first aid treatment. Arnica can be very helpful for both the external and internal pain, bruising, swelling, and bleeding of a head injury. It's best to seek professional homeopathic care when there are lingering chronic effects from a traumatic brain injury. In the event of an eye injury, use arnica for blunt trauma and bruising. The eye is the only part of the nervous system that is exposed to the exterior. Think, therefore, of hypericum for the pain resulting from an eye injury. Symphytum has a reputation as being the arnica of the eye. It's useful for blunt trauma to the eyeball and to the surrounding bones of the eye socket. It's a good remedy for the pain and bruising of a black eye. The two best remedies for dental trauma, whether accidental or from a visit to the dentist, are arnica and hypericum. Arnica should be given first for the soreness, bruising, pain, and bleeding that can result from dental work. And remember that hypericum is indicated for nerve pain or injury, which can occur in the case of drilling, root canal, or dental extraction. It's also indicated for puncture wounds, as when a dentist administers a local anesthetic like lidocaine with a syringe. Even though injuries to the spine can result in a wide variety of symptom patterns, it's always reasonable to administer arnica as a first-line treatment. Other common first aid treatments include bryonia, hypericum, and Rhus tox. Bryonia is indicated when any kind of motion aggravates the symptoms. Hypericum suits pain that travels along the course of a nerve or nerve pain that radiates from the neck or spine. Rhus tox can be given when we see that classic pattern of pain or stiffness that is worse upon initial motion, better from change of position or continued motion, and worse again from overexertion. In the event of a neck or spine injury, it's always important to get proper medical evaluation. The tailbone is the nerve-rich last segment of the spinal column. That's why a fall on the tailbone can be very painful. Think of hypericum for tailbone injuries. Cartilage is the softer, more flexible tissue that lines most joints. Periosteum is the fibrous layer that forms the outer surface of all bones. Two of the main remedies for injuries to these soft bony tissues are symphytum and ruta. Think of these two remedies, for example, for any injury to the tibia, the bony front part of the lower leg. It's worth mentioning that Bellis perennis can be useful for injuries to deep tissues. It's especially indicated for traumatic injuries to abdominal and pelvic organs like the uterus, liver, or spleen. In fact, Bellis perennis has a reputation for being the arnica of the internal organs. Furthermore, Bellis perennis is the main remedy to consider for injuries to the glandular tissue of the female breast. Of course, arnica can also be helpful for injuries to internal tissues and organs. Okay, so those are some of the main remedies used for basic first aid in accidents and injuries. All the remedies mentioned can be purchased together in homeopathic first aid kits. They're handy to have at home, at school, at work, at the ball field, on hikes and field trips, or any situation where injuries commonly occur. Please don't forget to subscribe to the ATH channel and be sure to click the notification bell. That way you'll be the first to know when new episodes are published. I hope you'll tune in again to the next episode of All Things Homeopathy.